Good morning, sir. I thank you for giving me this opportunity. And today my free paper is about Ectopia lentis, what, when and how. This is to show that the types of management of Ectopia lentis which we came across in our hospital. And today's agenda would be introduction to the topic, physical traits of the patients, overview of the cases with management strategies, visual outcomes and conclusion. And for the introduction, ectopia lentis refers to the hereditary or acquired malposition of the natural crystalline lens out of the patellar fossa. It could be traumatic or hereditary secondary to underlying systemic diseases. It can be autosomal dominant or recessive inheritance patterns. And for the management of ectopia lentis, the current practices we have are pars plana vitrectomy with lensectomy, cataract extraction with anterior vitrectomy, anterior chamber IOL, iris claw or iris sutured IOL, scleral fixated IOLs, PCIOL with CTRs and capsular tension segments, and also the use of femtosecond laser for subluxated lens management. So in our hospital, we conducted a retrospective observational study of children with subluxated lens in the outpatient department. All the data related to history, axial length, K values and all are taken from the DMR section of the hospital, and the baseline characteristics were studied. And to take a detour, ectopia lentis is also seen in children with short stature and also tall stature. In short stature, we have Weil-Marchesani syndrome, a 30-year-old female who came for blurring of vision at the age where we do not expect, but she came with the cataractous changes in her inferior subluxated lens. And also a 8-year-old child with the similar stature, short stubby fingers and short stature. But this child came with complaints of difficulty while reading and writing in the school, and with a headache while reading. And on dilatation, the child showed nasally subluxated lens in both the eyes with persistent pupillary membrane. And for the management part, the 30-year-old lady, we went ahead with iris claw lens with peripheral iridotomy. And for the child, his best corrected visual acuity was 618 with -10 diopters in both the eyes. And intraocular pressure was 25 and 34 millimeters of mercury. So NDR peripheral iridotomy was advised, but the patient did not come for follow-up. And now to come to the presentation of tall children with subluxated lens. Most of the patients had similar features like superior temporal subluxated lens, strabismus, some presented with shallow orbits, and all of them had arm span more than 1.04. So this is a case where we saw inferior subluxated lens and with a pedigree of this kind. The child had a sibling with similar features, and also cousins and paternal aunt with similar features who underwent surgery for in all the family, and all of them had arm span ratio of more than 1.04. And coming to the overview of the cases, how we managed, there are a total of 8 cases where 2 cases underwent iris claw lens with peripheral iridotomy. And to present a family of this pedigree which I have mentioned before, the girl was 13-year-old. She had infranasal subluxated lens and she underwent surgery. The vision improved to 612. And the 7-year-old sibling of this girl had a superotemporal subluxated lens for which we prescribed glasses. Considering his age, the surgery was not advised. And there is another 8-year-old boy who had tall parents but without any features other than the tallness, but had arm span ratio of more than 1.04, flat K superotemporal subluxated. And he had cataractous changes in his lens, so he underwent posterior chamber IOL with capsular tension ring, and the size of the bag was not sufficient, so both the haptics were trimmed and inserted into the IOL, and he achieved a vision of 624. A 6-year-old male again, but now this time he had a steep cornea and superior subluxated lens who underwent PCIOL. Since the bag has not dislocated, there is no gross dislocation, only with 8 mm pupil, the bag was still in the pupillary axis. And there is another family where 10-year-old and 6-year-old children came to the hospital with a grandfather who was wearing +10 glasses, because of which we understood that he might be of some syndromic approach. And both were prescribed glasses. And for comparison of visual outcomes, all of them showed an average of 4 lines of visual acuity improvement after surgery rather than with glasses. And to conclude, children were in the age group of 6 to 15 years. There is no sex predilection. Corneal curvatures can be flat or steep in all these cases. There is no pattern for subluxation, as we have learned. And the surgical correction always gave a better visual outcome than the glasses alone. So summarize, ectopia lentis has varied presentations with etiologies listed, and the management strategies cannot be designed and must be customized according to the vision and need of the patient.